Today in Lebanon, there is more destruction in Beirut's densely populated southern suburbs. Israel continues to strike what it says are Hezbollah targets there. United Nations Chief Antonio Guterres has also visited the city and says diplomatic channels remain open to end the war. Meanwhile, the Israeli airstrike in southern Lebanon on Friday night is still sparking many questions and condemnation. Local health officials say doctors and nurses are among the 12 people, at least 12 people, the medical personnel killed in that bombing raid on a healthcare complex. And the attack happened just hours after a strike on a paramedic center where 2 people were killed in another community. Lebanese officials report at least 826 deaths since the conflict began. Now, the World Health Organization has condemned the deaths of healthcare providers as tragic and is once again emphasizing that healthcare workers and providers must be protected. Dr. Abdinasir Abubakar is the WHO representative in Lebanon, and he joins us today from Beirut. Doctor, thank you so much for making time for us.
Thank you very much for having me.
Dr. Abubakar, since March the 2nd, the World Health Organization has verified at least 27 attacks specifically on healthcare facilities, on hospitals, on care centers, just in Lebanon. Are healthcare workers being targeted in this war?
Well, thank you very much for the question. I think, as you rightly said, what we have seen for the last 13 days actually is the gradual increase of the healthcare workers that's been attacked, actually, whether it's the healthcare workers, facilities, but also the ambulances. I think what we have seen is that I should agree with you that this is probably a targeted attacks for the healthcare workers and the health facilities in order to impede their humanitarian services and also their primary mission, which is saving lives.
Why do you think that is?
Well, I really cannot answer that question. But the reality is that, and WHO always advocates, is that health facilities, healthcare workers actually, should not be the target for all means and all the time, regardless of all the situation. And I think what we are seeing right now is whether it's an indirect attack or direct attack, I think the healthcare system, the healthcare workers, the facilities and ambulances have been attacked. And that's impacting the services provided to the vulnerable people where the conflict is affected. I think this is really serious situations where really need to be addressed because healthcare workers are protected under international health law and also under UN Security Council resolution. And that all parties need to follow those guidelines and all those resolutions that's been put in place.
Dr. Abubakar, I want to remind people at home that not only is Lebanon caught up in the warfare between the United States and Israel and Iran, but that part of Lebanon is also directly in warfare with Israel because of Hezbollah. So, with all of that context in mind and considering the incredible loss of life in Lebanon, can you give me a sense when you're going to the healthcare facilities or the hospitals in Beirut, what you're seeing, the kind of injuries you are witnessing?
Well, I think, when I go to the health facility, the hospitals and primary health care, there are two, groups of patients that I see. When I go to the frontline hospitals, I always see that, patients that's been wounded, actually, trauma patients, that requires an emergency management, that requires an ICU, that requires, fractures, and there are many deaths, unfortunately. There are also body parts that you'll see in the hospital. But unless we protect the healthcare workers, actually, we will not be in a position to support the wounded patients. At the same time, if you go to the primary health care, you will see that displaced people actually seeking health care, elderly people, women, and children that has been displaced from the south, from South Lebanon, South Beirut. And I think that is also a very important population that is really impacted by the conflict, beside those impacted by the war.
Let's talk about that a little bit more, sir, because I think I've got the latest information from the World Health Organization, which says in Iran, which is a central figure in the war, there's been about 100,000 people displaced. In Lebanon, it's 800,000. This is a massive number of people that are not in their homes anymore. Can we talk about the stressors on the healthcare facilities as a result of that?
Yes, indeed. I think, also the number of displaced people are 850 over 850,000. But we estimate that the number of displaced are over 1 million people. And those people actually are currently either they are staying with the community, host communities, or they're in shelters. And imagine now the healthy facilities that they have to serve that 1 million people. Many of the primary healthcare facilities, the hospitals, are overcrowded because they have to double their number of staff and also the shift and the medications they provide because the increased number of this, vulnerable people. Another point I would like to add is now it's the winter time. For the last few days, there's rain, the cold weather, and that's also impacting the health of the vulnerable people because they are staying in the shelter where it's congested, sanitation facilities very poor water quantity, and all this actually is, it's a public health risk that creates a problem.
Dr. Abubakar, in light of the many, many challenges that healthcare providers are currently facing in Lebanon, and now with the realization that they are subjects of attacks themselves, what are they telling you about why they come in day after day to care for people?
Honestly, I spoke to many healthcare workers in the front line, in the hospital, primary healthcare, and I really would like to commend their dedication, their bravery, and many of them actually are volunteers. They are not even paid. And they want, all what they want is to fulfill their mission, which is saving lives and to assist people who are in need. That's all what they want. And they wake up every morning, they take the ambulances, and also they go to the attack, the building that's been attacked to evacuate the wounded patients so at least they can save lives. This is their mission, this is their purpose, and I really commend their commitment and dedication, and they need to be protected at all costs.
It doesn't look like there's any end in sight. This war could continue for at least a few weeks. That's the latest information coming from the U.S. president. So in the meantime, what can be done and what can the global community do to support healthcare providers in Lebanon, but in the wider region?
Well, as the Secretary General have reiterated, as well as the Director General of WHO, I think we already have international humanitarian laws, which including Geneva Convention, which protected the medical personnel, health facilities, ambulances, and these need to be respected. And as a WHO, we are saying that all warring parties, whether it's Israel, whether it's Hezbollah, whether it's any other parties, they need to respect those international humanitarian laws. And healthcare workers must never be targeted or militarized. Health workers must be able to perform their duty to save lives. And I think this is what we are trying to advocate every minute, every hour, and every day at all levels.
Dr. Abdinasir Abubakar joining us from Beirut, Lebanon. Thank you so much, sir. Shukran.
Thank you very much. I appreciate it.